Welcome to Dentistry 101. Today we're going to discuss oral and maxillofacial radiology as a specialty and the role that it plays in dentistry and the applications of this specialty in different fields. So we'll start by introducing ourselves. I'm Erica Benavides. I'm one of the oral and maxillofacial radiology professors at the University of Michigan School of Dentistry, and I have been here since 2006.
Hi, I'm Fabiana Soki, and I'm also a professor at University of Michigan in oral and maxillofacial radiology. So let me start introducing oral and maxillofacial radiology. So oral maxillofacial radiology is one of the 9 recognized specialties by the American Dental Association, and it's involved in imaging and how we can use imaging to enhance the treatment and the diagnosis of the diseases of the teeth and the jaw. For you to become an oral and maxillofacial radiology, you have to complete 2 to 3 years of training after the dental school. And there are some programs that offer a combined master's and PhD training with the certificate training. Radiology is also an essential field in dentistry because it's involved in so many areas, from the diagnostic of diseases to the treatment planning and evaluation assessment. Because of that, oral and maxillofacial radiology gets to interact with all the different dental specialties.
Okay, so let's talk about the role of oral and maxillofacial radiology in the dental field. So our role can be divided into 4 main areas. We provide assistance with image acquisition. We also interpret images, we provide education, and we also contribute to research. So in the area of image acquisition, we are going to help provide the best image quality for the patients and select the best imaging modality depending on the patient's needs. And we're also responsible for protecting the patients from the effects of ionizing radiation. So that's also something that we keep always in mind. As far as interpreting the scans or the radiographs, we assist with the diagnosis and also the evaluation of disease progression and treatment outcomes. And we provide recommendations for management and follow-up evaluation depending on the condition. And as far as research and education, we educate not only the patients and the public, but we also contribute to training and education of the members of the dental and oral health teams, oral healthcare teams, and we also provide research in the area to advance the field.
Yes, and as you mentioned, we also participate actively in the education of the dental students, as well as the dental hygienists and dental assistant students. And that's very important because we can then teach them the knowledge, to have the knowledge and the skills so that they can apply radiology in their routine practices. We can do that by teaching them the theoretical courses when we teach them the didactic material where they can learn the theory and basics in principles of different imaging modalities. And we can also teach them important concepts on radiation safety and protection, as well as introduce them a very important systematic approach of how to analyze and interpret the images. So once they have learned the theory, they can then go into a more practical session where they can go to the laboratory to practice in the mannequins, as we've shown here, and in the clinics where they can practice with the patients. And that's a very important step because with that they can learn all the skills to critically evaluate the radiographs that have been taken. So with that, then they move on to smaller interpretation sessions where they can present to their students cases that were assigned ahead of time, and so that they can present the most important findings. And they can also go into the reading room where they can present their actual patients that they're working on, and then we can discuss their cases.
As far as the imaging modalities in dentistry, we have several intra and extraoral types of radiographs. For example, here we see periapical radiographs that are going to cover the entire tooth and the bone around the roots. We have bite-wing radiographs that are ideal for interproximal caries detection and to evaluate the bone level around the teeth. And we also have occlusal radiographs that are going to help you see things that are either in the palate or the floor of the mouth. And in this example, we see a sialolith, which is a salivary stone. We also have extraoral imaging modalities like panoramic radiography and lateral cephalometric images that are going to have a broader coverage of the jaws and the surrounding structures. And we have also available to us cone-beam CT or computer cone-beam CT technology or computer tomography that is going to allow us to see the images three-dimensionally and evaluate the patient, see from the soft tissue to the bone and the relationship of the teeth to the bone. And like in this case, on this patient, we can see also the presence of a lesion and evaluate the proximity of the lesion to the inferior alveolar canal and the proximity of the impacted tooth that is associated with the lesion to other teeth, and also the effect of the lesion on surrounding structures, as we can see on this video. These are also cone-beam CT images of the same patient, where we can see images like looking at the patient from underneath, looking at the patient from the side, and looking at the patient from the front, where we can see the effect of the lesion in the bone, the expansion that the lesion is causing, and also the relationship of this lesion to other important structures in the vicinity. So as far as emerging technologies in the field of radiology, we can divide them into optimization of existing modalities. For example, we have research being done to provide lower radiation cone-beam CT scans, and also to reduce the number of artifacts that we see on these scans. And there is also a lot of research being done in applying artificial intelligence to diagnosis, so to do computer-assisted diagnosis. We also have another field that works in the application of existing medical imaging modalities and to the dental field. And for example, we have dental MRI, dental ultrasound, and dental optical coherence tomography that are being developed and applied to dentistry more specifically. So in addition to that, there is a lot of research being done in education, how better methods to educate our students and the public about radiology in general.
Mm-hmm. So to summarize, our maxillofacial radiology plays an essential role in the dental field, in many aspects of the dental field. So because it's, as you mentioned, it's a rapidly evolving field with all these new technologies that are constantly arising, and the possibilities of applying medical imaging, different medical imaging modalities into the dental field, it's both exciting and promising. So with that, we'd like to thank you for the opportunity to be presenting and talking about our specialty, that's oral and maxillofacial radiology, and we hope you enjoyed the video.
Thank you so much for watching.